Hi everyone, my name is Russell Stowers. I'm the director for the Inpatient Rehab Department at Christus St. Vincent. This is just a brief overview that is intended to clarify when inpatient rehab is appropriate level of care for patients here in our organization. Inpatient rehab serves medically stable patients with significant functional decline who require intensive coordinated rehabilitation to safely return to their home or community. Many referrals clearly align with CMS-defined qualifying diagnosis such as stroke, spinal cord injury, brain injury, major trauma, amputations, hip fractures, burns, and complex neurological conditions. What you may not be aware of is that any medical condition or any diagnosis can qualify for inpatient rehab as long as they meet the functional impairments as well as medical complexity that's needed for these patients. So other medically complex patients that could also be included as referrals to our rehab unit include patients with respiratory failure, cancer, significant debility, or any other appropriate functional impairment that is substantial. Patients can come from any level of care, including our observation unit, home, emergency departments, other skilled nursing facilities. Really, the only level of care a patient cannot come from to an inpatient rehab facility is from another inpatient rehab facility. A patient can come from any level of care as long as they meet the medical complexity and the functional needs that they need. Appropriate patients are in our facility are adults. We do not have a pediatric rehab facility in New Mexico except at UNMH at Carrie Tingley, and that is the only pediatric rehab facility in the state. Patients must have reasonable expectations that they're going to make improvements with their progress within a reasonable amount of time. It's typically 7 to 14 days, but it can be longer. Some of our stroke patients stay anywhere from 21 to 28 days, depending on the complexity. Patients must be somewhat medically stable to come to our rehab unit, but they don't need to be 100% medically stable. Inpatient rehab is a high-intensity setting requiring interdisciplinary team with 24-hour nursing and frequent physician oversight. Medicare requires that a physician must see the patient in an inpatient rehab unit at least 3 times or more per week to manage medical complex issues. Patients also must require at least 2 disciplines, and those must be either physical or occupational therapy and or speech therapy. We also include orthotics and prosthetics in that when it's appropriate. Patients typically will get anywhere from 2 to 3 hours per day of therapy. Medicare requires 15 hours of therapy per week of therapy minimally for patients to receive in the rehab unit, but they can spread that over a 7-day period to where they're getting 2 hours of therapy a day and then progressing up to 3 hours a day. Physician's role in getting a patient to the rehab unit is that there must be clear documentation of comorbidities, prior and current functional status, goals, and of course progress and improvement with therapy is definitely needed in order to approve them. Inpatient rehab is not appropriate for patients that require only one therapy discipline. They need general conditioning, or they don't need skilled therapy interventions. That would be another level of care, typically a skilled nursing facility. And they safely can return to their prior level of function or to home with home health care. 80% of our patients from our rehab unit usually go home. In closing, the purpose of the inpatient rehab unit is focused on intensive recovery, helping patients regain function, reduce complications, and return safely to their lives. When medically complex functional impairments and rehabilitation intensity align, inpatient rehab delivers the highest level of care for post-acute care needs for our patients. Thank you very much.